So we had a price to pay. And we did that by starting a number of different activities. Some of you might remember the Howard University Mississippi Project and the neighborhood health center movement that Jack Geiger and John Hatch started down in Mount Bayou, Mississippi. And that program has continued to grow. We started a number of other programs in the 1970s. Then, in the 1980s, we had said that if we could just produce the data necessary to describe the problems our people were having, that America would just open its arms and solve all our health problems for us. So we published and worked on a series of books called the Heckler Report. I don't know if she ever read any of it. It was an interesting thing that is called the Heckler Report. And we waited for America to say we are going to work on solving the problems of health disparities among minority populations. And we waited, and nothing happened. Nothing happened. It's always interesting to me that some researchers today write articles on health disparities and say it started with the Heckler Report. It started with the failure of the Heckler Report. It wasn't because it was successful, it was meaningful because it failed. We knew data alone would not solve the problem of health disparities in America. We had to do something. So that started another activity beginning in 1991. 27 people meeting over at Spelman's College. It was interesting because the name of the meeting was "The Morbidity and Mortality Gap Is It Due to Race or Racism?" And some of the people who initially supported us, when they saw the word racism on the title, tried to back out of supporting the meeting. Today is the first time in American history where you will find a number of African Americans willing to say racism out loud. Because Confederates tell you that the problem is race. The problem is you don't look white. That's what the problem is. You wouldn't have these problems if you looked differently. The problem is not race. I don't know anything more stupid than people suggesting that the problem is race. The problem is not race, the problem is racism. It is not the color of your skin, it's the way you are treated because of the color of your skin. And if you haven't figured that out yet, may God have mercy on your soul.
That's right.
This is serious business. Democracy is serious business. It cannot function without the active participation of those who are affected by a democratic system. It is not. So I should tell you that I retired 2 months ago. I can say what the heck I want. So in 1991, we started an organization called the Society for African American Public Health Issues. There was also an organization in the APHA, the Black Caucus, which was started in 1969. My first meeting at APHA, I went into the main opening session, and I was sitting there, and then all of a sudden, all the black people got up and walked out. I said, what kind of organization is this? You know? And that's how the Black Caucus got started. The Black Caucus works on a lot of practical activities. It has a series of sessions within the APHA, and that takes a great deal of energy. But a small group of us wanted to change APHA. We wanted to work in the sections. We wanted to change policy. We wanted to make a difference in a different way. Now here's the thing that's important. In spite of those differences in goal, we have worked together. It is possible for African Americans to take different routes to the same outcome and support and respect each other.
That's right. All right. Yeah.
It was so unfortunate that Booker T and W.E.B. spent so much time arguing with each other rather than focused on the problem. We don't want to make that mistake anymore. You know, we can approach achieve these ends by using different routes, but doing it in a respectful and supportive way. And I hope that's what we've tried to do. We've got to change the way we do business. Got to change the way that we do business. There are a lot of things I would like to tell you. I think I would like to go through a short list of things, the changes that we've had. When I left CDC to come here to Morehouse to work on starting the first MPH program at HBCU, people needed to know that you could start an MPH program at an HBCU. And once that program got started, programs from all over the country started coming together. You just got to do it that first time. You've got to show that it can be done. And once you've done that, people will support you. People will support you, but you've got to do the work. Got to do the work. So there are things to be learned here. But I want to get back to one other thing. In 1983, I was asked to manage the first funds going to minority organizations for HIV in this country. On my second week in the job, I was going in to meet with the director, and there was a man outside named Dick Gregory. He said, HIV was invented in a lab and it was there to exterminate black people. And I was walking into the building with David Allen at the computer guy, Microsoft guy. What is, whatever it is, a bill or something. Yes, and I said, well, nobody black would believe something that silly. Nobody would believe AIDS was a conspiracy to exterminate black people, because it would require you to believe three things. It would require you not to pass 10th grade biology, because viruses mutate all the time. It is always figuring some way to get rid of these Homo sapiens. You know? Always. Second, it would require you not to understand how African Americans ended up in America. We did not come here on the Mayflower. We came as chattel, and we're valuable as chattel. Nobody tried to exterminate African Americans in the history of this country. Tried to scare the bejeebies out of us. Like the Klan, but they never tried to exterminate us because we're valuable. Our people buy 80% of the cognac market. I didn't even know what cognac was. But nobody's going to knock off people who buy 80% of the cognac. You know? We have to understand that the purpose of racism is to control. Control the way you think. Control the way you act. Control the way you spend money. That's what it's about. That's what it's about. Got to understand what this system is about and how it works. And we need a generation of people who can do that. And it will be a struggle. So when we started this effort in health disparities in 1991, we wanted to do two things. Number one, we wanted to make sure that African Americans were in the leadership of APHA. We wanted to make sure they were on the councils, on the executive board, and we worked to do that, and it's had its impact. We worked to change policy, to do policy on health disparities, and to get organizations to work together. And to some extent, it's worked. But it's like any other movement. It's any other, as it grows old, it gets, as it matures, it gets watered in certain ways. And sometimes we have to bring it back to where it was. When the idea of community participatory research was brought to us at the American Association for the Advancement of Science, it was based on the work that was done in science shop in Northern Europe. You know, connecting communities with scientists to identify and solve problems. One of the best community participatory research programs in the history of America is the Tuskegee study of untreated syphilis in the Negro male. It is also the most unethical research project in the history of America. How is that possible? How is that possible? Because no effort is actually solved in one dimension. There will always be people, and it's something that I learned very early on in my career. I've had a lot of help. I've had a life that's been easy compared to so many other people. But I've always also known that people help me not to do what I want to do, they help me to do what they want me to do. And there's a big difference in that. Big difference in that. You've got to understand what your direction and what your goal is, and it might be that those people who help you to do what they want you to do may not be the road you want to take. You've got to be strong enough to do whatever it is that you want to do. I always kept everything in boxes in my office. Still do. Because if somebody said, you can't do this, there are the boxes. You know, it's okay. You know, I can shine shoes. I know how to, you know, make a suit. I know how to make robes for preachers. I can figure it out. I can survive. But you've got to decide on your own direction. I don't want to spend a whole lot of time here because I want you to look up these kinds of facts yourself. I want you, though, to consider that there's a generation of African Americans who are aging out, not aging out, aging in maybe. When I was a student at Georgetown in Biostat, we would catch the 3P bus on Thursday at lunchtime to go to Howard University to listen to Dr. Hildreth Poindexter wax and wane about his life. He used to come in from the Maryland shore and come to Howard University Community Medicine Department and work, and then after he would have lunch at 1:30, and then we would get a chance to listen to him talk. That was an incredible experience, but it was an experience that we had to sort out ourselves. At this school, you have incredible people. Dr. Satcher there. You know, there are many other people. You should harass him. Every Thursday afternoon, there should be a group just listening to him talk about his experience in public health. You know, these are important, and I will ask. I've always thought that some of us should start a dinosaur club. All those who have lived beyond our life expectancy have a responsibility to talk to the young people who are coming behind us. You know? So I just hope that you could take some of these ideas and move forward. I do want to repeat one thing, because I think this is the next thing, that idea that forces us to think about new things. It is not race. It is time that we believe that the issues are not defined by our color. The issues is defined by our shared history, our shared goals, our shared commitments for a future for our families, our children, and the young people who are coming behind us. That's what should define us. Our culture should define us. And we do have history and values and culture, believe it or not. And it is time that we come together to appreciate that. If you don't know your family history, learn it. I'm very lucky. I grew up Geechee. So at 13, I was taken out, and the local historian for the church, community church, AME Friendship Church, told me my family's history. My aunt took us on Saturday mornings and told me my family's history since the last member came here in 1811. And having that history, knowing that my family has been in health for 5 generations, was important to helping me decide what I wanted to do. If you do not know your family history, if you do not know the illnesses that may affect you and your family, then you're doing yourself and your children a disservice. Because some diseases you should look out for. Learn your history, learn your community's history, and for God's sake, do something. It was an opportunity to understand what our young men are facing in this country, and to see them dominated in a police structure. Dominated, not just incarcerated, but dominated. And the sense of indignation that one can have when young men are just being almost slaves again. Yes. Look out for your young brothers, please.
Jenkins, for your words of encouragement tonight, and also for your 25 years of service in Zach. Okay, next, we're going to announce our awardees of our Poindexter awardees. We're going to, Dr. Jones, who our past Poindexter recipient, is going to help announce the various honorees.
We are delighted to announce that our Hildreth Poindexter awardee this year is Dr. Adewale Troutman. Dr. Troutman, his bio is also in the book. And shall I read it? Highlights. Well, I don't need to read it because Ade is a very good friend of mine, as well as a good friend of most of us in this room. He has been health officer here in Atlanta, as well as in Kentucky and many other places that I probably don't know. He actually changed the name of the health department here from the Department of Health to the Department of Health and Wellness. You know, they just made it to the Fulton Board of Health, so they just sort of switched that up on and he is probably most well known to many of you from his role in the groundbreaking PBS special, Unnatural Causes is Inequality. And that film continues to be used to illustrate for people that health goes beyond individual genes or individual behaviors, and that it's really about the context